Bismillahirrahmanirrahim. Today is incidentally a very important day for a lot of patients who around the globe, and because it's an important day for patients who suffer from what we call cerebrovascular accident or stroke, we thought of using this web portal to tell you what is happening today, what is the future of things, and why are we having so many patients who report with what we call a stroke. So we will be talking about what is going on around the globe, what are the statistics, what are the incidences of stroke of different types, and can we address the issue that that a stroke patient or a doctor is confronted with. So let's look at the stroke facts. Now, imagine stroke is the fifth leading cause of death in the United States. We're taking the example of the United States because the United States has population-based studies, and this is why we use the studies that have been established. And imagine that stroke alone kills about 140,000 Americans every year. So it's a mammoth phenomena. It's a mammoth um, disease or disorder which afflicts so many Americans. And 1 in every 20 deaths is due to a stroke or a cerebrovascular accident. A stroke is also called, in other terms, a brain attack because it is due to a clot that blocks the blood supply to the brain, or when a blood vessel ruptures or there is a hemorrhage. So there are two types of strokes. One is an ischemic stroke, and the other is a hemorrhagic stroke. So imagine someone every 40 seconds suffers from a stroke. Imagine the calamity, imagine the mammoth number of patients that would be involved on this planet Earth. And not only that, every 4 minutes, unfortunately, someone dies of this disorder called the cerebrovascular accident. Every year, almost 800,000, 795 is almost like 800,000 people in the United States would be suffering from this unfortunate ailment. And amongst those 800,000, almost like 600,000 are new patients. So imagine if every year you have 6,000 new patients with stroke, this is absolutely a calamity. It's a phenomena which is causing a lot of debilitation and destruction in human beings. But together with 600,000 odd patients that are new every year, we have recurrent strokes in almost like 185,000 patients. Continuing on with the stroke facts, stroke is an important cause of disability. Stroke reduces mobility, obviously. Even the mildest form of stroke is going to hamper or limit normal routines of life. Your quality of life will be affected by the mildest form of stroke. Imagine if the older the patient, for example, 65 plus, imagine the degree, the dimension of this disability would be absolutely amazing. And if you look at the costs, that a country like USA suffers 34 billion rupees is lost on treatment of stroke annually. It's huge. It's a huge mammoth amount, which is the cost from health services, medications, and loss of productivity or loss of quality of life. Continuing on with the global statistics regarding stroke. Like I've said, it is global. It devastates lives everywhere. Every nook and corner of the world is affected. Stroke is the leading cause of disability and the second leading cause of death globally. Second leading cause of death globally. And it can happen to no age is barred. No age is barred. Every individual, whether he is a child, an infant, a neonate, or an adult, can be afflicted by this unfortunate, often fatal disorder called the cerebrovascular accident. Survivors and families and friends and workplace people are equally affected because if an individual who is the sole earner of the family, it devastates and disrupts lives of every individual in that family. So the amount of strokes is huge. 17 million strokes, 6 million deaths, and 5 million of them are permanently disabled. So imagine the type of calamity it can do. Coming to, are the women also equally involved in this unfortunate disease or disorder? Yes. Not only that, stroke kills more than twice as many American women as breast cancer does. So if breast cancer is killing 100 women, stroke would be killing 200 women, for example. For more women than men die from stroke. Why is this so? Because the lifespan is longer. They have a longevity which is definitely more than what men normally have. Women suffer great disability of stroke than men, and the commonest surge that comes into the lives of women is between an age of 45 to 54, mainly due to an increased risk factors and the lack of knowledge of prevention. So we need to look into preventive medicine. Preventive medicine is important because once the stroke has affected the body, it is very difficult to improve on it. Now, the other important aspect that's going on is what we call research, and this is brain in time. Brain in time, people have been really researching on what a stroke or ischemic attack or loss of circulation can do to the various aspects of the brain. The brain consists of neurons, it consists of synapses, and of course the myelinated fiber. So if you look at the duration of the non-lacunar stroke, the actual stroke occurs in an acute fashion, but the process of ischemia continues for over 10 hours. And the estimated number of neurons that die in the forebrain alone is 22 billion. Huge, absolutely amazing. Extensive research has revealed that when a large vessel, I'm talking of the large vessel, has an acute ischemic stroke, you know how much damage it occurs, what it can do, how devastating it can be to the various parts of the brain. 120 million neurons, 830 billion synapses, and 447 miles of myelinated fibers are lost. Imagine there is no part of the brain that remains unaffected. It's a global phenomena, it's a global damage, it's a global destruction to what we call the brain, and brain happens to be the most important organ of the human body. Continuing with what we call the neurostereologist. Now, what is a neurostereologist? A neurostereologist is one who is doing research on various aspects of the brain. So a neurophysiologist have been able to estimate that in 1 minute, 1.5 million neurons. So everything is happening in just 1 minute. In 1 minute, 1.5 million neurons, 14 billion synapses, and 12 kilometers of myelin fibers are destroyed due to ischemia. Imagine. Imagine. This is absolutely devastating. This is absolutely debilitating. So people are going on to quantitative neurostereology. Quoted where we've got this from, the loss of brain in time of ischemia. Systemic reviews have estimated that the number of neurons, the number of synapses I've already talked about, and the myelin sheaths in kilometers are afflicted by the disorder. Now the question is, can we do anything to prevent stroke? Of course. But there are certain factors which we call risk factors, which cannot be altered, which cannot be changed. And these are called those that are non-modifiable factors. And amongst them, it's hereditary, age, gender, and ethnicity. Some medical conditions can be addressed, and the most important medical condition which causes stroke is high blood pressure. Do you know that studies have shown that if you control blood pressure, out of every 100 patients, 40 would not be involved. So 40% of the disability is caused by high blood pressure alone. But of course, there are other risk factors like high cholesterol or cholesteremia, heart disease has ischemic heart disease, it has the valvular heart disease, diabetes, overweight, and obesity, which is very common and increasing in proportion, not only in US, but here in our country called Pakistan. So the previous stroke or transient ischemic attacks, which are called TIAs, can also raise your stroke risk. So whenever you have a stroke, there is 10 times more chances of having a recurrence. So what do? Avoid smoking and drinking too much alcohol and not eating a balanced diet. All can be a causative factor to bring on a stroke. So what happens? What do we do? How do we treat them? Before I go into what is shown on my slides, I must tell you that the preventive medications are far and few. Aspirin happens to be the only treatment to prevent medicine as an antiplatelet drug. We know, of course, clopidogrel is definitely there, but clopidogrel should only be used when aspirin allergic patients are present. When there's no allergy to aspirin, that remains to be the number one treatment for prevention of stroke. So if you treat in the first 3 hours, 32 out of 100 patients will be saved. If you treat the patient in 4.5 to 4.5 hours, 16 out of 100 patients are helped. If a patient comes to you with a stroke, if he goes into a good unit, then 10 out of 100 patients are benefited. If a patient takes one aspirin a day, 1 out of 100 patients are helped. If a patient suffers a stroke, he can seek help by dialing the number in the US. I'm sure, have a similar number coming up in our country, Pakistan. So what are the advantages? If you go in early, what can we do? Now, this is when you treat an acute stroke, it is what we call the reperfusion therapy. The reperfusion therapy are two types: intravenous and intraarterial. Let's talk about it. But before we go into that, I must tell you that sometimes the high blood pressure is such a common factor that 70% of patients would be benefited if you control the blood pressure. And risk factors, we've already talked about them. We move on. So while we are talking of stroke, we must talk of our country, Pakistan, from where I am doing this session. We have a study, which is probably a population-based study done by a few centers in Pakistan, according to whom 30% of the population in our country, 30% of the population above 45 have high blood pressure, which is very natural. 12% of population above 15 are suffering from some sort of high cholesterol. So that needs to be controlled at an early age. There are 5 million diabetics in the Pakistani population. So making Pakistan the sixth largest country, I mean largest in the sense that diabetic population wise is the sixth largest country in the world. And if this horrendous continuation of the disorder continues, diabetes will be inflicted or will affect 30 million people in 2020 and will then become, unfortunately, the fourth country in the world. So how many new patients do we see per year? According to the population, according to the study that we are quoting, 350,000 new patients every year. The highest incidence is, of course, is found to be in the Pakhtuns with high blood pressure and stroke. 25% patients of stroke uh, without hospital services. You can, if you take them to the hospital, 25% patients die if you don't take them to the hospital. So recurrent stroke. After stroke, preventing a second stroke is very important because, like I've already talked to you about, the recurrence, the risk of second stroke is tenfold, 10 times higher. Imagine. So someone who's had a stroke, you have to go in as and whatever you can do to prevent the second stroke, because the second stroke can very well be catastrophic and fatal. Preventing second stroke addresses conditions like atrial fibrillation, which can give you cardioembolic strokes and narrowing the carotid artery in the neck. So, repeating again and again, please control blood pressure, control diabetes, and control your high cholesterol. So, what do we know about the intravenous thrombolytic therapy? The intravenous thrombolytic therapy is the mainstay of treatment, provided the patient reaches the area or the hospital that has the gadgetry and the conditions for TPA. And you have to have clearly defined symptoms. If you reach the hospital and you're given a TPA, you're lucky. What does TPA do? It initiates the local fibrinolytic process. It binds to fibrin in a thrombus and it converts plasminogen into plasmin. And then what does plasmin do? Plasmin breaks the thrombus, which we need to do, into fibrin degradation product, and the patient is almost free. This is called what we call clot bursting procedure. Benefit of TPA lasts for 3 to 6 months. It can always recur. So one has to be very careful. One has to address the possible uh, risk factors so that recurrence do not occur. Because I've just told you, a recurrent can be very fatal. Each 15-minute reduction in time to initiate this TPA can worsen things by almost 4%. Mechanical thrombectomy is indicated in certain conditions, but is not at this point in time used in Pakistan. But for those youngsters who are going to the USA or the US or Europe, we need to at least tell them what is mechanical thrombectomy. Mechanical thrombectomy patients, the large arterial occlusion in anterior circulation within 24 hours, regardless of what you do, you give them TPA, you must go in and give them a chance for thrombectomy. It's a mechanical process, and they use what we call the clot retraction gadget to retract the clot from the occluded artery. Issues limiting widespread use of mechanical thrombectomy. Only 10% of the patients with acute ischemic stroke have a proximal large artery occlusion. Anterior circulation present early enough to qualify. So there are very few patients who really qualify, but they do qualify, they will be hugely benefited. While 9% of presenting patients, 6 to 24 hours, they may qualify. So you can go as far as 24 hours before you address the thrombus for mechanical thrombectomy. Few stroke centers have sufficient resources. Every center in the US is now trying to introduce this procedure because it can do a lot of benefit. It can be very beneficial to the patient. So eligible patients can be given IV TPA. If you are in a hospital where TPA is given, you can give IV TPA and then prepare the patient for a possible thrombectomy. So the process of infusion for TPA and then shifting the patient to the proper unit is now called drip and ship process. Antiplatelet therapy, I've told you, clopidogrel is recommended for patients with aspirin intolerance or allergy, or for those who cannot tolerate diparacetamol. In this country, in Pakistan, we do not use what we used to call percentin or diparacetamol. It had some major side effects, so we have stopped using that. Warfarin and the combination of aspirin and clopidogrel should not be used in the prevention of ischemic stroke. Combination therapies can increase the chances of intravascular or intracerebral bleeding. Atrial fibrillation is often in our country, even elsewhere, an underdiagnosed, undertreated heart condition. The major risk factor for stroke. It's a major risk factor for stroke. So one must diagnose. This is the message for youngster doctors, for students, for postgraduates, for residents. Please clinically examine the patient. Number one, atrial fibrillation causes two major upper chambers of the heart to quiver, and so that the heartbeat is affected, resulting in blood not being completely pumped out, which in turn causes pooling and can lead to what we call clotting. So clot will travel to the brain, triggering a stroke. So do address strokes with air, which is highly preventable by anticoagulating substances. Aging brain, compared with the normal rate of neural loss in aging brain, obviously, when the brain ages, everything ages. And the ischemic brain ages by 3.6 years each hour. Imagine the calamity. Quantitative estimates of the piece of neuronal circuitry loss in human ischemic stroke emphasizes the time for urgency in stroke care. High fiber diet. This is very important. All I'm going to say here is that high fiber diet is very important in prevention of stroke. What does it do? What has the global studies shown us? The global studies have shown that the high fiber diet can reduce cholesterol and control your weight, which is very important, especially in women on average who eat 13 grams of fiber every day. It's very, very important. To ensure you're getting enough fiber in your diet, 25 grams daily by women. Try to incorporate plenty of whole grains, brown rice, whole wheat bread, quinoa, fruits, and vegetables into your diet, and you'll see that things will get better. As far as low salt diet is concerned, of course, it's important. But tell them to take low salt diet because, like I've always advocated, high blood pressure remains the key risk factor for strokes. So low salt diet is very important. But let me tell you, in our general population, sometimes a patient comes to a doctor and he says, do not take salt. No, a little bit of salt is very important for the human body. Otherwise, you can go into hyponatremia and into hyponatremic coma. So managing a completed stroke, once a stroke has occurred, it's very difficult. Once stroke is completed, only physical rehabilitation and speech have a role to play. The only drug that has been established amongst the antiplatelet agents, like I've told you, is aspirin. Remember, citicoline, we use a lot of citicoline in our country, and I'm sure it has some role to play. People are working on it, studies are going on. In the time window, the role of TPA is absolutely dramatic. It can save a lot of debilitation and, of course, deaths. Interventional clot removal is always a great help. But of course, you have to have the right units, you have to have the right gadgetry, and you have to have the specialized stroke units who actually do that. Anticoagulants are only helpful in stroke patients with valvular heart disease. Thank you.